So, thanks everyone for joining us today. My name is Vi, and I'm a registered physiotherapist as part of the Long COVID Rehabilitation Program at Cornerstone. We're joined today by Heather Tomar and Heidi Pola, our two registered dietitians within Cornerstone. They'll be talking about strategies to balance caloric intake, mast cell activation syndrome, and ways to reduce inflammation. I will be monitoring the chat for any questions that come up during the presentation, so feel free to pop them in there. And this session will be recorded, and the link will be shared with all participants. Okay, let's get started.
Okay, thanks, Vi, for the introduction. My name is Heidi, and I'm going to start with the first portion of our presentation on balancing caloric intake and reducing inflammation. So often we get asked how to help manage weight, as weight gain is common with our long COVID patients. We see our patients becoming less active, having less energy overall. We also see a lot of changes in eating habits when our patients will lean on more convenience or processed foods for comfort and as a way to ease the burden of meal preparation and cooking, which is completely understandable. And so we're really going to dive into what's happening in the body today with long COVID metabolically. But what's important to know is that essentially our bodies are experiencing an energy crisis, and long COVID puts significant strain on the body. Therefore, our approach is typically it's not a time to create a severe calorie deficit because this can create more stress on the body and actually exacerbate symptoms. So instead of focusing on a reduction in calorie intake, what we want to focus on is overall good nutrition and weight maintenance rather than intentional loss. So this helps ensure that we focus on meeting needs for energy, healing, and daily functions. And I will say sometimes in making improvements to overall diet quality, we will see weight loss more as like a happy outcome of the changes that we're making. And this is okay, but the intentional restriction and weight loss is not our primary aim. So what are the tools that we can use to allow us to identify eating patterns and assess if intake is sufficient is by tracking our intake. And there are a number of tools that we can use to do this, and apps and websites as well. And this is something we may suggest doing for a short term because it gives us a bit of a snapshot into how you're doing as far as your diet goes. We might look into macronutrients like protein and certain other nutrients like fiber, saturated fats. And in working with the Cornerstone team, you can enable your wearable devices or the data from some of these sites like MyFitnessPal or Chronometer to share information with us and connect through the Cornerstone Connect app. So this is just a screenshot of some of the data we have for our sample patient. And again, one of the tools we can use to help assess and manage your overall nutrition. As far as other tools we can use, the balance plate, this is a really basic one, but a pretty powerful tool. It's basically a model we can use for building a nourishing and balanced meal. So it breaks down key foods that we should include, as part of our meal and roughly the proportions we want to include. So what you'll see here, it's pictured here on the side. We're aiming to include half a plate of our non-starchy vegetables. So we're aiming for color, we're aiming for variety here. And then as we move around the plate, we want to include a quarter plate of protein-rich foods. So those can come from animal-based sources, so whether that be meat or fish, but also plant-based sources. So we're going to look at things like legumes, nuts and seeds, beans, tofu as a great option. We can also get protein from eggs, as well as some of our dairy products like cheese, milk, uh, Greek yogurt, cottage cheese, things like that. So that's a key portion of the plate. And then lastly, for the last quarter of the plate, that would be your whole grain choices or those starchy vegetables. So certain vegetables actually fall under this category, like potatoes, sweet potatoes, or corn. So essentially, when we're taking a look at meal planning or your meals, we kind of want to see this model, and that helps ensure those nutrient needs are met, but then you're also going to be kept full and satisfied. We'll also be looking for healthy fats included as part of the meal as well. So in addition to the balanced plate, another thing we want to keep in mind to ensure that our caloric intake is balanced throughout the day is eating regularly throughout the day. And that really helps to support energy levels. And what that looks like for most patients is, eating maybe every like 3 to 4 hours. It's important that we pay attention to our body's cues, for hunger and for fullness. But every 3 to 4 hours is like a good general guideline. We want to avoid going like really long periods of time without eating. And sometimes, so, if we've got long periods of time without eating between meals, like that's where a balanced snack might come in handy as well. So again, this is just going to support us with meeting our needs and our energy throughout the day. And some of the key nutrients that we can also take a closer look at, that we may look at if we do some nutrition tracking or we'll do some education on, are things like protein and fiber, because these really help to keep us full and keep us satisfied. And having more protein and complex carbohydrates, which are higher in fiber, and other sources of fiber spread throughout the day, can really help to stabilize our energy levels. So again, it comes back to like this balance plate tool. It kind of helps put this all into practice. Um, the last tool that I want to review is the hunger scale. And this is another really powerful tool that we can use to become more aware of our body's hunger and our fullness cues. And it typically ranges from 1 to 10, with 1 representing more extreme hunger or feeling starving, and 10 representing extreme fullness or being uncomfortably stuffed. And the goal here is to help you eat in response to your body's needs rather than external cues like emotions, social situations, or the presence of food. And the scale can be used throughout the day, to check in, see how you're doing, but we can also use it during a meal to slow down, pause, and assess your fullness and your satisfaction with your food. So the scale here is just one example of a hunger scale, but there are many different versions out there. I also have some patients who like to fill out their own scale because we all tend to feel hunger, satiety, and fullness in different ways with our body. Um, And most of our patients find that they feel best and most comfortable when they are between, say, like a 3 and a 6 on the scale. As we find more extreme hunger usually results in poor food choices. And then to make up for that extreme hunger, we're often eating beyond the point of comfortable fullness. So again, using this as a tool in addition to some of the other strategies I discussed, like regularly eating and balanced meals and balanced snacks, can really help to support uh, our that we're meeting our calorie needs, but in a balanced way. Okay, so shifting gears a little bit now, we're going to talk a little bit about inflammation and long COVID. Just some background information on what inflammation is. So, inflammation is your body's protective response. And there are a few different types of inflammation in the body, and it's not always necessarily a bad thing. So, acute inflammation is a normal and a healthy process, It's your body's rapid response to injury or infection, like, getting a cut or having a cold. But with long COVID, what we're actually seeing is chronic systemic inflammation, where inflammation, um, the response goes awry and persists for weeks, months, or even years. And it's that inflammation that's an underlying factor behind many of the symptoms that you may be experiencing, like fatigue, brain fog, shortness of breath, muscle aches, and others. So, in terms of how inflammation works, it's helpful to understand cytokines. And so, we can think of cytokines as tiny protein messengers or signaling molecules that immune cells use to communicate with each other. And they're really crucial for initiating and resolving inflammation. So, pro inflammatory cytokines promote inflammation. And with long COVID, these remain elevated. We also have our anti-inflammatory cytokines, which help to reduce inflammation. But with long COVID, we see an imbalance with an overexpression of those pro-inflammatory cytokines, which do contribute to those symptoms. So what we are looking to do is we're looking to shift this imbalance. And while medication can also play a role, your daily food choices are a really powerful and accessible tool to help to manage that inflammation. And so, what you can eat can either fuel inflammation or help to calm it down. And our goal is to minimize inflammation in your system by focusing on anti inflammatory foods and decreasing foods that may contribute to that inflammation. And one way I like to look at it is it's not about restriction, it's about abundance and choosing the foods that can support your body's healing. So I want to go over what some of the key dietary strategies are that we can reduce or we can use to help reduce that inflammation. So, first thing we can do is we can focus on more whole foods and unprocessed foods. And we'll talk a little bit more about, how to go about that today. We're also going to want to try and aim for an abundance of plant foods. So again, going back to that balanced plate, like trying to fill half your plate with colorful fruits and vegetables at mealtime is key. We also want to include healthy fats in the diet. So certain fats we really want to aim for more of are things like olive oil, a fantastic choice. And we may also want to look at choices that are rich in omega-3 fatty acids as well. So fatty fish is fantastic here too. Kind of leads into the next point. We want to look for more lean protein options as well. And, the fatty fish being a great protein choice. Then we might also look at more plant based proteins. Things that also have a good amount of fiber in them, which is also going to be helpful. So, our beans, our lentils, chickpeas, things like that. We're going to try and aim for more poultry as opposed to red meats and processed meats. Um, we also want to focus on quality carbohydrates or more complex carbohydrates that are going to be really rich in fiber. Things like whole grains, oats, brown rice, whole grain breads, quinoa, uh, barley, things like this can be a great choice here. And then we also want to recognize that we need to kind of scale back on foods that can contribute to inflammation. And we're going to talk about what those foods are on the next slide here. Um, Okay, so in terms of foods that can contribute to inflammation in the body, some of the foods and nutrients that we want to limit and our diet overall would include our more highly processed foods. So, packaged snacks like chips, granola bars, crackers, cookies, low fiber sugary cereals. frozen dinners, as well as fast foods. There's a lot within this category. We're also wanting to reduce foods that are high in added sugars. So sugar sweetened beverages are a big one. We also want to be aware of added sugar in, even things like yogurts or granola bars. We also want to have less foods like candy and dessert that are naturally higher in sugars. And then we also want to limit the amount of refined carbohydrates. So I talked about on the last slide, those, whole grains and those more complex carbohydrates being important. So yeah, we're really wanting to lean more towards those and less towards, the white breads, white pasta, pastries, things made with refined flours. Other things that we want to reduce are saturated fat intake. So, saturated fats we find in fried foods, as well as red meat, higher fat dairy products, butter, baked goods. And then we're also wanting to reduce red meat consumption, as well as processed meats. And lastly, alcohol, because that can also contribute to inflammation in the body. So now that we've kind of talked about foods we want more of and foods we want to limit, sometimes our patients find it's helpful to kind of have a model to actually use to implement these recommendations.
Heidi,
So,
before we
yeah.
move on, we just have a few questions in the chat. So, Carrie's question is, can you suggest foods that are more economical? This diet is really expensive and I'm on disability. I think this is referring to the low inflammatory food slide.
Okay, yes. So I think that actually it lends itself nicely actually with the Mediterranean diet pyramid, because this is actually like how we can put this into practice, and I would love to provide examples throughout. So definitely, we want to focus on lots of fruits and vegetables. We can do this by, buying fruits and vegetables in season. We want to aim for variety and color, but buying in season is one way we can save some money. We can also tap into frozen fruits and vegetables too, and stocking up when they go on sale. The plant-based proteins are super economical. I love beans, chickpeas, lentils. I think these are fantastic staples that we can use. And again, it's a key part of the Mediterranean diet. You can see here we have our foods that we really want as our staples, as the lower part of the pyramid here. And a lot of these foods, yeah, are those plant-based options. You'll also see the fish and seafood being a key part of this diet, and that can include canned fish. So I love canned tuna and I love canned salmon. Those are great options too. So I think there's a lot of ways we can, incorporate this diet in a way that is quite economical.
Yeah.
Yeah.
Okay.
Eggs too, versus like having red
Hmm.
meat as a source of protein.
Right.
Yeah, there's lots of suggestions. Yeah.
Yeah, a lot of alternatives. Yeah.
Hmm.
Another comment that was there is like maybe you could speak about fish and beans being high in histamine, although they're recommended foods that are good for your body. So could you speak to that perhaps?
Yeah, I think probably Heather's part of the presentation will address that really nicely. I think we wanted to kind of lay the groundwork for foods that can reduce inflammation overall. I think this is a good foundation.
Mhm.
And when we find, we've kind of mastered this part and we've built that solid foundation, then we can kind of get into things and fine tune a little bit. And maybe the histamines are something we explore in more detail. So I think Heather's present half of the presentation will address that question specifically.
Sure,
Yeah.
we'll wait for that. Um,
Mhm.
And can you address whether heating olive oil for frying changes the fat structure slash benefits versus using olive oil in dressings?
Yes, it does. That's a really good question. I'm glad someone brought that up. Yes, olive oil is like a key part of the Mediterranean diet. It recommends up to like 4 tablespoons a day. Um, However, I will say that it's not the best for all applications because of its smoke point. So usually above like 375, 400 degrees, it does start smoking, and then we see that the nutrient, like all of the benefits, can be destroyed. Ideally, it is best for those lower temperatures. A great alternative that is rich in those monounsaturated fatty acids that is also a great option, and you can use at higher temperatures, is avocado oil. So I usually like to keep both in my pantry.
Yeah, absolutely. Another question is, can you suggest quality carbohydrate ideas for folks with IBS where non-soluble fibers can trigger diarrhea?
Yeah, I would say that would probably be something that would be a little bit more individualized, because IBS tends to be um, not the same for everyone, where certain foods can trigger symptoms. I know this is a little bit probably more in Heather's area of expertise. I know she works with a lot of GI patients, but I would say tends to be fairly individualized. Um, so we were looking for low soluble fiber um, options.
Okay.
Yeah.
Mm-hmm.
Heather, I don't know if you want to jump in. I know you know FODMAPs in and out.
Myself. There we go. So low soluble fiber is what this person's looking for. Yeah. So brown rice isn't terribly high in soluble fiber. And quinoa would be another option, but again, that's going to be a little bit higher in fiber. But also it is a low FODMAP. So both rice and quinoa are low FODMAP. Flaxseed, ground flaxseed is low FODMAP. Chia seeds are low FODMAP. So those could be options. Sometimes when people don't tolerate fiber really well, it can be a gradual reintroduction. And I'm talking like a tablespoon a day, right, for a week or two. And then it's 2 tablespoons until you find what your threshold is with your IBS. And then it also depends if you're flaring with your IBS as well. So those would be things to, like Heidi said, kind of work with somebody on who has a pretty good understanding of it. And of course, our clients bring us a wealth of their own knowledge too of what they can tolerate. Yeah, so I would stick with brown rice. Probably would be the thing to do there. But it is always good to try to work up to a decent amount of fiber if we can.
Good. And I think last question for you, Heidi. How do we know how we're doing in terms of reducing inflammation from diet? Is there any way or metric to measure progress?
Yeah, that's a good question. I think we can look at this from a number of perspectives. I mean, there are some markers in blood work that can be used, but I think we also look at symptom reduction. Like, how are you feeling, right? Like, how does your long COVID present, right? So, are we feeling, I mean, there's lots of different symptoms, but are we feeling, um, you know, even a little bit better in terms of like brain fog, or if we're experiencing like GI symptoms? Um, so yeah, I think it's individualized. Not everyone will have the same response to all the different strategies. Yeah,
Yeah, so more like symptom based and kind of
symptom based. Yeah,
individualized. Mhm.
yeah.
Yeah. Okay. I think.
If I can just hop in there
Yeah.
for just a sec. So also to the amount of time on an anti-inflammatory diet, it's not as if you're going to, shift the diet like a 180 and you're going to start feeling better in a week or two. It's the long haul, and over time it could be very, very subtle changes. So I like to try to help my patients notice that. Are my elbows just a little less achy, or do I feel just a little less stiff when my feet hit the ground in the morning, or I open and close my hands, right? So it does take time.
Yeah, that's a good reminder. Okay. So we'll jump back into, if there's not any more questions, we'll jump back into the Medi diet. So yeah, as I mentioned on the bottom here, we really have those foods that we want in most abundance, our staples in our diet. So fruits, vegetables, grains, olive oil, beans, nuts, seeds, legumes, and then using herbs and spices to provide flavor to the food. Um, as you work your way up the pyramid, we have fish and seafood as being, primary sources of protein. We also really like to focus on lots of omega-3 fatty acids because of all the benefits there. And so the specific fish that we can get those omega-3s from include things like salmon, herring, mackerel, trout, and sardines. But I mean, all fish and seafood can be beneficial, but we want to have, fish often, at least 2 times per week. And I would say, those omega-3 rich choices, if we can try and have those a couple times a week as well. Then we work our way up the pyramid. We have poultry, eggs, cheese, and yogurt, moderate portions daily to weekly. And then our meats and sweets being our choices that we have less often, and that would include our processed meats as well. You'll also notice that wine is pictured here. Now, if you're not drinking currently, it's not a reason really to start drinking. Research has changed with, alcohol intake. We do know alcohol can also contribute to inflammation in the body. So that's probably something we would want to, minimize overall, but we can certainly pull from, you know, the overall eating patterns here. And like I said, it incorporates almost all of the anti-inflammatory principles we've discussed today. Okay, so let's talk about, how we can incorporate and implement this eating pattern. So I'd like to provide a few more practical tips. So I want to just first start off by saying that I want to recognize that capacity, energy, and cognitive resources to make changes can be limited with long COVID. And it can be, challenging to make large changes and do an overhaul in the diet. So what I do suggest is starting with a few small changes, maybe 1 or 2 small changes, holding with those before we introduce other changes. Really, those baby steps are key in long-term success with healing. Second, we can kind of also do a little bit of meal planning, because this can really help us put, some of these foods, incorporate them into our diet if we've actually like planned out what we're going to have. I think some of our patients have all the best intentions, and they go out and they go grocery shopping and they, purchase these foods, but if we haven't really thought about how we're going to include them, or we don't have, recipes, or we don't feel we have the skills to, prepare for some of these foods, we don't want them to go to waste. So even doing just a little bit of planning can be quite helpful. And, we don't have to work all from new recipes. We can just write out what we normally have and think of ways to like sneak in some of these foods here and there. Okay. Um, Other things that we may want to also do is build some of our skills when we are grocery shopping. So, excuse me, I'm just going to take a drink of water. Becoming a little bit more savvy with label reading is a great skill, and that will allow us to identify certain foods that are higher in some of those nutrients we want to keep an eye on, whether it be, added sugar, foods higher in saturated fat. So that's also something that we can support with as well, in working with a dietitian. And then, where possible, we also recommend that you cook from home. So, excuse me, perhaps if energy is low, we can lean into more convenience options like frozen vegetables, already chopped vegetables, rotisserie chicken, canned fish. I think there are ways to go about implementing this diet, even if, the energy is low, if resources and budget is low. There are certainly lots of options we can consider. Some of our patients also really enjoy meal subscription boxes because it takes, some of the planning, some of the chopping, measuring of ingredients, some of that, uh, those tasks that can be quite, heavy. And it takes that out of the equation, and we're simply just, assembling and cooking. And other things we want to do is kind of goes back to what Heather was saying, and what the patient was asking about, in terms of, how do we know if these changes are working for us? I think we need to listen to our body. I feel like, you as a patient are an expert on your own body. And so we need to tune into, what is working for you, and we can listen to, what our body is saying in response to making these changes. And so we may, pay attention to our energy, our digestive health, and the rest of our symptoms. And this can help inform your overall care plan. And last but not least, we encourage you to seek support. So, whether that be from family members or friends, and perhaps they can assist with some of the tasks like grocery shopping, meal preparation, and of course, our dietitian team. The rest of the long COVID support team with Cornerstone Physio would be more than happy to help you in this journey. So yeah, that's everything from me for today. I think unless we've got questions, we can move on to Heather's portion of the presentation.
A lot of the questions are based on like histamine, so we'll just wait for Heather and then get them. But thank you for that, Heidi.
Okay, sounds good. I'm just going to mute here and we can.
Okie doke. Hi, everybody. I'm Heather. I'm just going to go ahead and dive right in so we have plenty of time left for questions. I'll be working with dietary approaches to mast cell activation syndrome and histamine intolerance like symptoms. So we have, you can advance the slide, Heidi, if you would, please. So many of you have likely heard about mast cell activation syndrome, or MCAS, and maybe have even heard about histamine intolerance in forums or other support groups that you're in. What we have noticed in our patient population and their histories and observations, there's some suggestions that they may benefit, or you all may benefit, from some strategies commonly used for these two conditions. Many people with long COVID experience similar clinical patterns to these conditions. And so we can leverage these treatments and rehabilitation approaches to improve your condition. And so today, what I'd like to do is explain to you just a little bit about what mast cell activation syndrome is, what histamine intolerance is, or HIT, and then move into how we can incorporate a low histamine diet and what that looks like, and how it may or may not work for you. And I did want to, before we move on, I just wanted to thank Heidi for laying a great foundation, because inflammation is a theme that's going to run through our entire presentation today. And so unless you're experiencing some of the symptoms that I'm having, what Heidi talked about is a great place to get started. And then we build on that. So if you could advance the slide for me, Heidi. So mast cells and mast cell activation syndrome, or MCAS. What are mast cells? So they're normal. They're a normal part of your immune system. They're found everywhere in the body, and they are our frontline soldiers in our body's immune response. So they're a good thing, right? So they're important. They're responsible for storing and releasing necessary and natural chemicals. About 200 different chemicals are released from these mast cells in the normal immune system. But what happens in mast cell activation syndrome, these mast cells become overactive. It's not that you have too many. It's like almost like the trigger has been pulled and it's gotten stuck. And so these chemicals are firing out into your body at a number that's much too high. And then people with MCAS feel unwell because of all of these different chemicals being released. Go ahead and advance the slide. So chemicals that mast cells release, again, these are important chemicals that our bodies need, but some of them, of the 200 plus, are histamine, which we'll talk much more about later, proteases, leukotrienes, cytokines that Heidi had mentioned, these pro-inflammatory chemicals that get released, and tryptase is another one. So today's presentation is going to focus in on histamine as we move forward. Go ahead and advance the slide. So some common symptoms that people see in mast cell activation syndrome in terms of body systems. So we have stomach and digestion. So people may experience bloating, diarrhea, constipation, gas, reflux. They might be heart-related issues, fast heart rate, palpitations, low blood pressure, dizziness. You may experience skin issues, flushed skin, hives, rash, itchiness. I'm breathing and respiratory issues, swollen throat, wheezing, itchy nose, runny nose. Sometimes people get a runny nose while they're eating, and that can be kind of a sign that something's going on here with the food that you're eating. It can also impact the nervous system, so which could lend itself to brain fog and headaches. So for many of you out there, some or all of these symptoms are familiar to you. The other thing is they can sort of ebb and flow. They can vary. They can fluctuate from day to day. So it's something to keep an eye on if you're noticing a conglomeration of these symptoms, and perhaps this dietary approach could help. Go ahead and move forward. So diagnosing MCAS is very complicated. Diagnosis is currently based on symptoms and the exclusion of other causes. So many of you may have experienced going to multiple specialists to try to figure out, okay, what are these symptoms together all meaning for me? Their uniform testing protocols are not agreed upon, and getting a diagnosis of MCAS is made by the process of elimination, in addition to blood, urine, and skin biopsy from qualified medical practitioners, such as an immunologist. So it is a very complicated syndrome that has not been researched a lot up until the last maybe 5 years. So I think we're going to see a lot more coming out around mast cell activation syndrome. You can go ahead and advance the slide. So mast cell activation syndrome triggers. So there's a long list here: stress, alcohol, high histamine foods, which we'll be talking about a little later, strong scents, temperature change extreme from cold to hot can be triggering, exercise, infection. Some medications can trigger a histamine response, actually. mold exposure, and then other triggers such as warm environments. So, luckily, through our long COVID program, you're working with our practitioners on stress reduction and pacing of exercise. So, hopefully, damping down some of the triggering that could be caused by being too active or having too high of a stress load. So the low histamine diet really is just a piece of the puzzle of mast cell activation syndrome. So you can go ahead and advance the slide. So the treatment of MCAS, so antihistamines, these are the kind of a first line treatment, an H1 and an H2 blocker. So they block histamines in the body. H1s would be like Allegra, Claritin, Reactin, Zyrtec. And then an H2 would be something along the lines of Pepsidase C, Tagamet, and Zantac. Now, a lot of people get placed on these through their doctor. So keep in mind, though, with the H2, this is not a PPI. This is an acid reducer that also acts like an antihistamine. So sometimes people end up on a PPI, but it doesn't exactly do what we want it to do in terms of the antihistamine. If you are found to have mast cell activation syndrome and you do get a diagnosis of it, there are mast cell stabilizers that a doctor can prescribe, leukotriene blockers that can be prescribed by a physician, monoclonal antibodies, those could also be prescribed, and steroids. What we try to do to get a sense of if your body is going to respond, we try a low histamine diet. Also, a low FODMAP diet or an elemental diet can be used. An elemental diet is incredibly restricted. The low FODMAP diet really addresses mostly the GI distress that people experience when they're having mast cell activation syndrome. The low histamine diet kind of addresses both the upper and the lower, so the upper respiratory stuff and the lower histamine response. So if you want to go ahead and advance the slide. Are there any questions so far? Anything I should answer now?
One of the questions is, are there complications taking antihistamines if they're on hormone replacement therapy?
Oh, that one you'd want to ask your doctor about. Not to my knowledge, shouldn't be an issue, but definitely check with your physician around that.
Yeah, and there's
Good,
another
good.
one that was
Mhm.
asked in terms of like going into more detail of the nuances to bodily signs when listening to your body's reaction to foods. So looking at, thinking about itching around the ears as a sign of a histamine reaction, having nightmares at night, or ringing in the ears, like perhaps getting into some of the common symptoms to histamine reactions.
Yep, and we're gonna get there.
Okay.
Okay. Um, yeah, we'll just keep moving
Yeah.
forward, and I'll make sure I answer that. And if I don't, whoever asked that question, raise it again. Okay, so then we move into, so we're leaving MCAS, which is a very complex syndrome, and moving into histamine intolerance. So as I identified, the mast cells release lots of different chemicals into our body, histamine being one of them. So right now we're kind of like funneling down just a bit and looking at just histamine. It's an important component in the immune system and the nervous system. Histamines can trigger the immune system and cause symptoms like swelling, rashes, watery eyes, which is kind of the typical histamine response. But it also affects the nervous system and may cause problems such as headaches, digestion problems such as gas, bloating, and pain. And in addition to the histamine that our body creates, it's also naturally present in foods or can develop in foods. So that's kind of where we're moving to next. So so histamine intolerance. So it isn't truly an allergy. Histamine intolerance is a mismatch between too much histamine in the body and the speed at which your body is clearing it out. So we kind of have this overflowing bucket situation. If too much histamine is released or it's not broken down fast enough, a person may not feel well. Keeping in mind that each person has their own tolerance to their histamine levels. So the next picture kind of just shows, if we could advance the slide, sort of that overflowing bucket situation. So when we think about a low histamine diet, we may think about, so the water all flowing out of it is like the body's saying, no, there's too much here. I'm not able to clear it out. So if we can use the diet to bring the level of that bucket down, um, we may be able to reduce some symptoms, right? And they might not completely go away, but they may become less bothersome. So I really like the whole bucket idea, and we all have a different size bucket. So as Heidi was mentioning, sometimes the diet can be very individualized. Some people may have to go very extreme with their histamine elimination, where some people may get away with a more moderate elimination. Okay, you can advance the slide, please. Thank you. Symptoms of histamine intolerance. So definitely some overlap here from what we talked about with mast cell activation syndrome. So we have bloating, diarrhea, stomach pain, anxiety, hives, itching, runny nose, red color or flushing of the skin, wheezing, watery eyes, sleep disturbance, swelling of the tongue and mouth, severe menstrual pain are to name some. So you can go ahead and advance. So histamine intolerance diagnosis is also challenging along with the MCAS. So similar symptoms can be seen in other conditions, including food allergies, IBS, as someone had mentioned, and gluten sensitivity. There are other diets specific to each of these conditions, and this is something that Heidi or I can help you try to identify, um, given your history and filling out one of our intake forms. As we move through trying to figure this out. So for food allergies, we would address it through testing, through your doctor, and avoiding the allergic food, of course. With IBS, you can try a low FODMAP diet, which Heidi and I both do. And then if you think you might be gluten sensitive, this is where a lot of people start, right? They think, okay, so something's not right here. I notice when I'm eating less wheat, rye, or barley, I feel a bit better. So this can be a way to get started with figuring out if you're having some food intolerances. Okay. So this is the meat of the presentation. So employing dietary strategies used in MCAS and histamine intolerant for people with long COVID seems to help a cohort of our population. So I wanted to go over what that looks like for you. In case it's something that you are interested in trying or have wondered about, maybe are too scared to try because it seems too scary. But anyway, so I just want to kind of give you a nice overview of what that can look like. So a low histamine diet is an elimination diet. And you see, I put it in quotes because we can't completely eliminate all histamines from the foods that we're eating. So it's really a low histamine reduction, an extreme reduction in the beginning, and then we can add some things back in. So basically, it lets us see if decreasing the load of histamine in your system is helpful to manage your symptoms. The goal is to minimize the overall amount of histamine that you get from foods and reduce foods that block the action of the DOA enzymes. So that is an enzyme. It is diamine oxidase. So that's an enzyme that can be low in people who have a hard time clearing histamines. So a low histamine diet is not a no histamine diet. As I said earlier, it's impossible to eliminate histamines completely. Okay, so you can go ahead. So these are some general tenets of a low histamine diet. Quick tips to get started. Fresh or frozen is best because the longer food sits around, the histamine levels can begin to rise in certain foods. So someone had mentioned, well, hold on, Heidi, canned tuna is high in histamine, and it is. For the general population, canned tuna and canned salmon are probably fine. But if you feel like you might be dealing with a histamine intolerance, um, avoiding canned, smoked, or dried meats and fish is is part of this elimination phase. Avoid fermented foods again, but aren't fermented foods good for me? It's the fermentation process that makes the histamine go higher. Reading labels here, you're looking for preservatives and additives that can be high in histamine. Freeze it. This is something that we can do with leftovers so that you don't have to cook fresh every single night. So if you batch cook something and then stow it away in the freezer, you halt the histamine increasing in it in its frozen state. So if you pull it out, thaw it quickly, as quickly as possible, rewarm it and consume it, your histamine level should stay low. And then avoiding artificial coloring and preservatives. So those are just sort of an overview. What does a histamine reduction diet look like? So reduction of the most problematic foods. Now there are more. So this is something where our patients get really confused because there's so many different lists out there. There's the SIGHI list, that's a crowdsourced list. There's Mast Cell 360, which that seems to be a pretty good list. This list is from an MD who also specializes uh, in histamine intolerance. So these are going to be the most concentrated, I guess, in histamine. So if we go through here, we look under fruit, we've got citrus fruit, strawberry, banana, pineapples, and pears. A lot of people are like, oh, my banana, right? But remember, this is not for the rest of your life. This is just for a short period of time to see if you respond to the diet. Under vegetables, eggplant, avocado, tomato, olives, legumes, and spinach. Dairy, we have fermented cheeses, other fermented foods like kefir and yogurt. Can be a challenge for people who are dealing with histamine intolerance. Protein, tuna, mackerel, anchovy, shellfish, sausage, and lunch meats also can be high in histamine. Bleached flour, anything made with that bleached flour, is going to be high histamine. Vinegar, including apple cider vinegar, soy sauce, hot spices, and chocolate, all can be high histamine. Fermented foods like beer, wine, pickled foods, kombucha, sauerkraut, and kimchi. And then coffee, alcohol, black tea, orange juice, and lemon water. So again, this may take away a bulk of foods that you are currently enjoying, but if you decide that this is something you want to try, Heidi or I can supply you with a list. There's a huge list of foods that you can still eat to fill your plate and make that healthy plate. I ask people to try to stay on this reduction or elimination for 2 to 4 weeks. I had a very interesting experience where a patient, I was supposed to follow up with her in 3 weeks, and she said had our appointment happened and we had to postpone for one more week, she said, I would have told you this diet did nothing for me. But by week 4, she was feeling remarkably better. So the longer you can stick with it, to see if you may have benefits from it is best. Okay, go ahead and advance the slides. Anything I should address yet here, Vi?
No, I think we're okay.
Okay, great. So this is these are the least problematic foods, and there are a lot more. Blueberries, apricots, cranberries, apples, mangoes, peaches, onions, potatoes, asparagus, broccoli, squash, cucumbers, beets, corn, You can have butter, cream cheese, pasteurized milk is okay. Ricotta and a little bit of cottage cheese and some mozzarella cheese is okay. Eggs, freshly cooked meats, if they're cooked from frozen or cooked like the day you bring them home, we're really pretty good. If you let the food sit in your refrigerator for days and days and days, the histamine does continue to rise. So that's fish that is fresh or frozen. You can have rice and oats, fresh and dried herbs, salt, water, herbal teas, fruit juice, except those are from a citrus source. Any questions on the elimination? No?
So there's a question on how to find healthy probiotics slash fermented foods once you're in the reintroduction phase, which, you might be touching upon now.
Yeah, so we'll get there now. So thank you for that. So what does a histamine reintroduction look like? So people will often ask me after they've been through it, either people will say, I feel so much better. No, thank you. I don't want to reintroduce anything for a while. And you could, so that's fine. And Heidi and I will make sure that the foods that you are able to tolerate are balanced and that you're meeting all of your dietary needs there. But if you do decide you want to reintroduce, really, I have people, we come up with the idea together. What do you miss the most? Right. So that might be a really good food to start with. Let's say, for instance, you just really miss wheat. So maybe that's the food we start with. And we start with a very, very small amount over a 2-day period. And then we wait a day because the effects can be residual. So you may, and it can be a load issue. You may be fine having bread day 1, but day 2, you're like, ooh, some of my symptoms are returning. So then that could be a threshold issue for you, or it may be that that food just isn't for you right now. We may want to try that further on down the line. So if you keep records during this period, thanks, Heidi. If you keep records during this period, that's really helpful for Heidi and I to help you track kind of what your symptoms are and if symptoms have gotten better, or if during the reintroduction phase you find your symptoms get worse. So are there any questions around the low histamine eating?
There's a question on what is the connection between getting MCAS or having MCAS if the patient already has environmental allergies? Is there a correlation between them?
I don't know. Yeah. Yeah, I think there are a lot when we look at the symptoms of MCAS. There, it's all sort of woven in there together. So if environmental allergies were already there, and then long COVID came along, and we had this sort of massive release. It could be, but I'd have to leave that for an immunologist or an allergist.
Identify. Mhm.
Yeah.
How do we know if a symptom like a headache is related to MCAS, histamine intolerance, or caused by some other aspect of long COVID? So how are we able to identify that?
Yeah, it's really hard. So here's the thing with the low histamine diet is there is some testing and some guesstimation from physicians that maybe you have it, but I think the proof is in the pudding. If you try the low histamine diet and then all of a sudden you realize, oh, I haven't had a headache in the last 4 weeks, then that may be a clue
Mhm.
that there could be something there. So it's really something like a headache is really, really hard, be very hard to to be able to determine if it's going to respond to a low histamine diet. And again, this diet isn't for everybody. But if you do have the conglomeration of symptoms that are sort of all overlap, it may be something that you would want to try when the time is right. as one of our clients had mentioned, the energy level and the thought that it takes to arrange cooking around a new diet can be really challenging. That is where Heidi and I can help as well. We can try to help you simplify it as much as possible.
A question from Adam. Curious about vegetarian options like tofu, edamame, and lentils. I guess in the context
Yeah.
of like his low
Yeah.
histamine diet.
Right. So if you are vegetarian, so I have to always grab my list because this is not an intuitive diet. So lentils are okay, small amount. Edamame is fine, and that one is you're a little more free with. A small amount of tofu is okay. Um, so kidney beans, black beans, navy garbanzo, chickpeas, and lentils. So there are some that are going to be worse. And you want to try to start with fresh dried beans. These are things that would probably would work back in after a short elimination, just to make sure that it wasn't causing, like, because beans in general can cause some GI impact. So there are some options around that.
Great. Do you recommend any supplements in the context of MCAS and long COVID, such as magnesium or vitamin C?
Mm-hmm. Both are ones that I very commonly recommend, of course, based on an individualized assessment. There is one flavonoid called quercetin that can be used and acts somewhat as a mast cell stabilizer. So it inhibits the release of histamine. It's commonly found in foods like blueberries, broccoli, kale, asparagus, red onion, ginger, turmeric, and capers. But I'm going to say non-pickled capers, right? Because then those would be a fermented form. So, yeah, but in terms of MCAS specifically, no, because we haven't had that many people who actually have a formal diagnosis of MCAS. We're sort of leveraging this antihistamine diet, and it seems to be helping a, a decent cohort of our clients.
This is a question that I have. I know there's some murmur about being anemic and in the context of long COVID. Have you identified within your patient population whether low iron levels can worsen any of the long COVID symptoms and whether improving iron has helped any patients?
So I think Heidi would agree. We hop on that one ASAP. If we see somebody who comes to us already having a history of low iron, and typically we'll ask them if they haven't had it checked in a long time to have it rechecked, because it does kind of genetically run in families where people just tend to run low. Menstruating women, of course, tend to be on the very low end of normal, if they can even get up into normal. Ferritin levels have been raised now so that the low end is no longer, what was it, Heidi, like 13 or something like that? I think it's been raised up to 30. So I think we're in the medical community, we're realizing how important it is to have adequate iron stores. So what was the rest of the question?
And whether you're seeing any improvements in particularly like their long COVID symptoms with an improvement in their iron. That might be hard to tell.
I can't make any really direct, but people just feel better
Yeah.
when their iron levels are where they're supposed to be.
Better.
Yeah, more
They sleep better. Yeah, they sleep better. Their hair stops falling out. They're not so lethargic. Absolutely.
Good.
So we try to look at all deficiencies. If somebody comes to us, saying, oh, well, I had a vitamin D deficiency and I took some vitamin D and it became normal, but I haven't checked it again in a year, we definitely want to correct any deficiencies.
Yeah. And There's a question on DAO supplements, just like what is
Yeah.
DAO?
Yeah. So diamine oxidase is an enzyme that our body naturally produces. And it's theorized that maybe people who struggle with clearing these histamines are low in this enzyme. I've only had several clients use it. It cannot be purchased directly here in Canada. At least most of my clients have had to have it shipped from the United States. Um, and then this is just my personal experience with clients. Some people think it helps and some people don't.